Good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Thursday, March 16th, 2023. And our top story today, what is the Medicare Advantage open enrollment? Well, joining me now to discuss this and a lot more, Frank Winter is with the Centers for Medicare and Medicaid Services. Frank, it's great to see you again. Thanks so much for joining us on the program this morning.
Good. Thanks for having me. Good to be back, Jeff.
It's always a pleasure chatting with you, and I'm so glad that you could come on to talk about Medicare Advantage. When we last talked to you, we talked about the Medicare enrollment period. Now we're talking about Medicare Advantage. Just real quick, remind us, the audience, what is Medicare Advantage versus Medicare?
So Medicare Advantage is really a different way to get your Medicare benefits through a private company. So you can get, your Part A, your inpatient benefits, your Part B, your outpatient benefits, and your prescription drug benefits, your outpatient prescription drug benefits, all through one plan if you'd like to do so. They're offered by different private insurance companies that are regulated by Medicare. And you do have the same appeals rights, et cetera, as you do under original Medicare. But there may be some additional benefits. What you pay may be different. You may pay more for certain things and less for certain things.
Frank, in terms of this open enrollment period, when does it run? It's January. I think it starts January 1st of the year, but it runs through March. Is that correct?
Through March 31st. That's right. And so folks, if they signed up for Medicare Advantage if they have Medicare Advantage, or if they signed up in the fall and maybe you're not happy with the product you picked, this is a great opportunity to switch to a different Medicare Advantage plan, or to go with original Medicare. Maybe you answered, you saw an advertisement for a particular plan. You thought it was going to be great, and a couple months into the year, you're like, I'm not so sure I want to stick with that plan. This is really your opportunity through the end of this month, through the end of March, to make a switch and go for a different plan, maybe back if you had a plan you liked before, or if you want to go back to original Medicare.
And it's kind of like a mulligan in golf, I think. Is that the right term, where you kind of have a do-over, and it's really a really good opportunity? Frank, how do we take a look and compare and contrast the plans? Because people, maybe like you said, they looked at an ad, they saw an ad, and then they went to a website. But is there a tool or resources on the CMS website that they can, or the Medicare website that they can go to do some comparisons?
Yeah, Medicare.gov is a great place to start. You can do a personalized search if you open a Medicare account, and you can save your list of prescription drugs that you're taking, so you can get a little more information loaded in there when you do your search. But you can compare the plans based on the networks they provide, what they charge for certain services, what your prescription drug costs you can expect them to be, and that's all available on Medicare.gov. Folks, if you want help with it, you can call 1-800-MEDICARE. They'll help you as well go through that. And there are counselors across the country through programs, we call them SHIP programs, the State Health Insurance Assistance Programs. And they'll help you with this as well. And you can get in touch with them either by calling 1-800-MEDICARE and ask to be connected with a SHIP counselor, or if you still have your Medicare and You handbook that we send every year, it's this red, white, and blue handbook. On the back cover is the number for your local SHIP counselor. So they can talk to you about Medicare Advantage and really other choices. If you have other Medicare questions or choices you have to make relating to your Medicare, they are a great resource. The nice thing about the SHIP programs too is there are some state benefits that are different in each state that sometimes work with your Medicare coverage. Those SHIP counselors are well aware of those type of programs, so they can help you sign up for them, let you know what's available in your area.
Yeah, really good point. And those resources really important before you make that choice, before you come to the end of the open enrollment period, make sure you know what you're getting and what you're going to pay. Frank, I need to take a very quick break. My apologies, but we got to pay the bills. Frank, when we come back, we're going to talk more about Medicare Advantage open enrollment, what you need to know, and how it compares to Medicare. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms? Especially for the smaller businesses. I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you stuck with a low credit score? A credit report and score that's causing you to be denied credit or pay higher interest rates than others for the same things? Then do what Terrence did and call Credit Repaired for your free credit evaluation to help restore your credit.
I started thinking about buying a new house, and my score wasn't where I needed it to be. I called and spoke with one of the representatives, and we just had a good conversation, and I liked what he was saying.
Just one call for his free credit evaluation was all it took to start back on the track to repairing his credit.
I'm seeing the deletions and I'm getting the report, so I know something's being done. It does make a difference to me.
All it takes is one call to get started.
Credit Repair has given me a second chance to have a better credit score.
Don't let a low credit score hold you back another day. Do what Terrence did and make the call for your free credit evaluation.
Call 800-819-4152. That's 800-819-4152. Again, 800-819-4152.
Welcome back. We're joined this morning by Frank Winter of the Centers for Medicare and Medicaid Services. Frank, thanks so much for staying with us this morning.
Yeah, great to be here.
Frank, do you have a feel for how many people in the country, in the U.S., are signed up for Medicare versus Medicare Advantage? My understanding is Medicare Advantage has become kind of popular.
Yeah, it's very popular. It's approaching 50%. We're not quite there yet. It's over 40% of Medicare beneficiaries have Medicare Advantage, and we've seen a gradual increase in that over time. It's particularly popular a lot of times in urban areas and suburban areas, where a lot of times there are more options, but there are Medicare Advantage plans available, some of them with a zero premium, all over the country. So there may be one in your area that's available for no premium.
Yeah, and so very, very popular. Frank, you mentioned in segment one that is this overseen or regulated by the Medicare Health and Human Services, Medicare? Do they kind of regulate who the providers are, the premiums, the coverage, et cetera?
Yes, they're regulated. They have to, provide the same benefits as on original Medicare. We also take a look at, for example, the customer service they provide, whether they're following all of our rules and regulations. And on the Medicare website, we actually have a star rating system where people can look at a particular plan and see how they're doing in terms of satisfaction by their members and following Medicare's rules, et cetera.
It's kind of like the Michelin star system for restaurants, right, or hotels. Frank, are there things you can't do during this enrollment period that people need to be aware of? That the enrollment period concludes, the open enrollment period concludes March 31st. But are there things that we can't do if we are for example, enrolled in just the general vanilla Medicare?
Yeah, if you're in original Medicare, you can't sign up using this for Medicare Advantage using the Medicare Advantage open enrollment period. It's really a period where you can switch Medicare Advantage plans, or you can go back to original Medicare if you want to from Medicare Advantage. But if you do have original Medicare and you want to go into Medicare Advantage, or if you want to sign up for prescription drug coverage or switch your prescription drug coverage only, that's not something you can do during the Medicare Advantage open enrollment period.
Well, Frank, we're going to have to leave it there. Always great to catch up with you. I'm so glad, by the way, we could work out all the technical difficulties on my end.
Absolutely.
That's just life. Always great seeing you. Thanks so much for joining us. And we look forward to having you back on the program again very soon.
Great. Thanks for having me on the program. Appreciate it.
And that wraps up this episode of BRN AM. Have a topic of interest, somebody you think we should talk to, drop us a line. And don't forget, for all the latest curated news and lifestyle, wellness, finance, tech, so much more, all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? We'll visit our website and, of course, all of our streaming partners. We're back again tomorrow for another edition of BRN AM. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.
Tax audits, tax liens, wage garnishments.
Every day we hear stories like this about good folks who are simply struggling to pay their bills. Each of them are living a frightening IRS tax nightmare, and they are afraid it will destroy their lives.
I'm a divorced single mom, and my ex-husband left me and the kids with a lot of unpaid bills, including unpaid taxes. I was really starting to show my stress on my kids because the IRS had sent me a letter demanding a huge payment from me. I couldn't afford it. So then the IRS was threatening to garnish my wages. I'm already living paycheck to paycheck. That would have put me over the edge financially.
It truly seemed hopeless, but then a friend at work told her to call the tax relief line.
The people at the tax relief line, they told me about something called innocent spouse relief. They worked it out so that all of the taxes from my ex are not my problem. I don't know how that works, and I don't care. All I care about is that I don't owe the IRS a dime, and they are not going to take my paycheck.
Even if it seems hopeless, you should call the number on your screen right now. There is absolutely no cost for the call or the consultation. You are under no obligation. If you are worried that the IRS could garnish your wages, seize your assets, even take your home, call us right now. The Tax Relief Line is here to help you. Now you have a knowledgeable, professional team of tax experts that are ready to negotiate with the IRS and fight for you to save you money. The Tax Relief Line's professionals have successfully negotiated thousands of cases, reducing and sometimes even eliminating the tax debt for their clients. It's very easy to get started. Simply call the number on your screen right now. You don't have to live in fear anymore. The call and the consultation are free.